as we said, are transferred to the fetus, and it gives protection during that important first 6 months, where that window of non-immune, non-vaccination period it gives. And we have also seen that in babies.
Common cold, it is basically because of number of viruses. When you identify it as influenza or para-influenza, it is by doing a test. Or if you are in a season where there is a large number of influenza patient, you can presume it is because of influenza. But to confirm that it is influenza, you need to test. And now testing is difficult because we have got rapid tests, which will give us the report very quickly.
Is it mandatory now?
It is not mandatory. It is preferable if you are going to start treatment in a very sick child.
Because patients will say one more vaccine, my God.
Yeah, so that is exactly what we need to address. A very good question was asked whether about the influenza vaccine. See, influenza vaccine right now is an optional vaccine because it is in the private sector. So what can be done is the healthcare, that is the doctor can only recommend please give this vaccine. Ultimately, whether to take it or not is the parental choice. The parent is after all going to decide for their child. So we can tell them what are the risks and the benefits. Risks of not taking the vaccine and the benefits of taking the vaccine. So we explain this to the parent and leave it to them to decide to give the vaccine.
मैं डॉक्टर परवेज कौर हूँ, कश्मीर से हूँ एंड आज जो हमने मीटिंग करी इन्फ्लुएंजा वायरस और इन्फ्लुएंजा वैक्सीनेशन के बारे में। इन्फ्लुएंजा का सीज़न है आजकल कंट्री के बहुत सी स्टेट्स में, और इन्फ्लुएंजा एक जानलेवा बीमारी है और एक बिलियन के करीब लोग हर साल इससे इन्फेक्ट हो जाते हैं, और 5 से 10% एडल्ट्स और 20 से 30% चिल्ड्रन हर साल इससे इन्फेक्ट हो जाते हैं, और तकरीबन आधे मिलियन से ज़्यादा लोग मर जाते हैं इसकी वजह से, इन्फ्लुएंजा और इसकी कॉम्प्लिकेशंस की वजह से। और ये इम्पॉर्टेंट है कि इन्फ्लुएंजा का वैक्सीन लिया जाए, जो एक मोस्ट इम्पॉर्टेंट प्रिवेंटिव टूल है हमारे हाथ में, इन एडिशन टू जो हमने कोविड के टाइम पे नॉन फार्माकोलॉजिकल मेजर्स किए, जैसे मास्क की, सोशल डिस्टेंसिंग, क्राउड्स अवॉइड किए, घर पे बैठे रहे। सो उन जो मॉडलिटीज़ हैं उनके अलावा मोस्ट इम्पॉर्टेंट जो अवेलेबल वैक्सीन है वो इन्फ्लुएंजा वैक्सीन है, और इन्फ्लुएंजा वैक्सीन रिकमेंडेड है 6 महीने के अलावा जिसकी भी एज हो उसको इन्फ्लुएंजा वैक्सीन एनुअली लेना चाहिए, ये हर साल लेना होता है। और अगर हर कोई नहीं लेता है, फिर जो हाई रिस्क ग्रुप्स हैं, जैसे बहुत छोटे लोग जो उम्र में काफ़ी बड़े हैं, और जैसे 65 ईयर्स ऑफ एज से ऊपर और 5 साल से कम, और वो लोग जिनके ऑलरेडी क्रॉनिक लंग कार्डियोवास्कुलर डिजीज़, डायबिटीज़ हो या लिवर डिसऑर्डर्स या किडनी डिसऑर्डर्स हो, उनसे पहले ही अफेक्टेड हो, तो उनके लिए कॉम्प्लिकेशंस का रिस्क ज़्यादा रहता है, और उस वजह से उनको इन्फ्लुएंजा वैक्सीनेशन के लिए प्रायोरिटाइज करना चाहिए। इन एडिशन हेल्थ केयर वर्कर्स और प्रेग्नेंट फीमेल्स को भी प्रायोरिटाइज करना चाहिए इन्फ्लुएंजा वैक्सीनेशन के लिए, हर साल लेना चाहिए, हर एक को लेना चाहिए। थैंक यू।
I am Dr. Jyoti GS. I am the professor and head of the department of obstetrics and gynecological department at Ramaya Medical College and Hospitals, Bengaluru. Today I have come here to speak about the importance of giving influenza vaccine during pregnancy.
Yeah, good evening, ma'am. There are just few questions.
Yes.
Why is it important for pregnant women to get vaccinated against influenza?
Yeah, it is very important. Why is it important? Because we know that pregnancy is a very vulnerable period where there are changes in the immune system, other physiological changes take place involving the cardia, the lungs. And during this period, if the pregnant lady contracts influenza disease, then it can lead to severe illness, which by taking influenza vaccine, it will halt the progression of severity. The severity of the illness could range from the patient being hospitalized, patient being admitted in ICUs, and even mortality. And not only that, it's not only protective to the mother, it is also protective to the baby And the same thing happens in the baby also. If the baby of the mother suffering from influenza, then those babies are low birth weight babies, they go into preterm delivery, and these babies, small babies, preterm babies, they get admitted in NICUs, and again the morbidity and the mortality increases along with the cost.
I'm the infectious disease consultant at Apollo Hospitals, Banerghatta Road.
So why is flu still a major public health concern, especially in India?
The reason is simple. We have a large number of population and we have large number of vulnerable group of population. So when I say vulnerable, maximum population of children, maximum population of adults over the age of 60, maximum number of population with diabetes and bad diabetes, and maximum number of population where immunity is less, including those with cancers, those on treatment for cancers and HIV. So these are the vulnerable groups in India which are in maximum, and that's why it's still a public health concern. Also because vaccination is not part of the immunization schedule and most of these people do not take vaccine at all.
How annual vaccination help in preventing outbreaks?
Because every year flu changes itself. It's an intelligent virus. So if at all we give the vaccine based on the previous year's recommendation, it doesn't help at all. So when there is an updated guideline, you take the vaccine as such, it will protect you and the vulnerable group of people. So the outbreaks will not happen at all.
What is the benefit of flu vaccination in practice?
In practice, like we already discussed, it prevents major illness. It will not prevent you from getting infected. But if you get infected, you have taken the vaccine, you will not have any bad disease, you will not get hospitalized. The chance of you entering into ICU is significantly lesser.
Who to you should take flu vaccine?
If available, everybody above the age of 6 months should take flu vaccine, if available. But based on the current scenario, at least the vulnerable group, like we said, children, those more than age 60, immunocompromised group, diabetics and pregnant women.
Do doctors and hospital staff take flu vaccine?
Yes, most of the hospitals have a policy where it compels the staff to take vaccination. Most of the hospitals.
One quick message you would like to give about flu vaccine?
Vaccinate yourself. So that's the simplest of the message possible. If you have an opportunity to spend less than 1,000 rupees on a vaccine, please take the flu vaccine.
Thank you so much.
These patients who are on dialysis will have to visit the hospital 2 to 3 times a week. That is 8 to 12 times a month to undergo dialysis. So they are in touch with the hospital environment and therefore they need to be protected by the